So, good morning to one and all present here. Myself, Dr. Naresh Kumar Ranga, Associate Professor at working at ISF College of Pharmacy. So, today I would like to invite in the ISFCP dialogue series Dr. Jeena Gupta, who is working as Assistant Professor at Department of Biochemistry, School of Bioengineering and Biosciences, Lovely Professional University, Phagwara, Punjab. Her title of talk is Glycemic Memory and Epigenetic Modifications in Diabetes. So let me introduce to her. Dr. Jeena is alumni of Punjab University and Naipur Mohali. She obtained her master's degree in biochemistry from Punjab University, Chandigarh in 2005 and PhD in pharmacology and toxicology from Naipur Mohali in 2012. She was a postdoctorate fellow at Cancer Research Center, Laval University, Quebec, Canada. She is having more than 11 years of teaching and research experience. She has obtained DST Travel grant to attend conference Epigenetics 2009 at Melbourne, Australia in 2009, and she's CSIR JRF fellow, JRF and SRF fellow, and she has qualified GATE examination in 2005 conducted by IISc Bangalore. She has about more than 50 research papers in various reputed national and international peer-reviewed journals. She is an editorial board member of Frontiers in Endocrinology journal and external reviewer of more than 10 journals. So with this, I welcome today's guest speaker, Dr. Jeena Gupta.
Thank you, sir. Thank you for the nice introduction. Shall we start the session?
Yes, sir.
Okay. So thank you for this introduction and an invitation for inviting me for this talk. Today, I'm going to discuss about one of the important aspect of diabetes, which is called as glycemic memory. We are working in our lab on this aspect in the last since the last 5 years, and we have seen that glycemic memory is basically the major factor which is responsible for diabetes. At first, I want to explain you what is glycemic memory. Actually, what we have seen that people with progressive age they develop diabetes. Okay, so diabetes is basically a metabolic disorder, which we say that type 2 diabetes particularly, which we say that it is a lifestyle disorder which occurs because of the changing lifestyle nowadays. Okay, but what happens? The major factor which is responsible for diabetes as we consider is hyperglycemia, increase intake of glucose and increase in the persistent level of glucose in our blood, okay, in the blood of the diabetic patient. Uh, but what happens? People are of the idea that when they normalize the blood glucose level, the modifications, the diabetic complications may reverse. Okay, so like for example, if a patient tends to maintain the blood glucose level below, like in the range of normal, the diabetic complications may subside. But this is not the case. Okay, what happens is that when a person takes glucose in the diet, even a transient spike in glucose, like even one time if there is hyperglycemia in the blood of the diabetic or not diabetic patient, even the normal patient also, the normal person also, even when we take the high amount of glucose in our diet, that glucose causes some malfunction in the human body which retains its memory. Okay, so this transient spike of glucose, the memories, the complications which are associated with the transient spike of glucose will accumulate with time. Even when there is a next spike in glucose, the complications accumulate, eventually leading to a complex disease which is called as diabetes. Okay, so this phenomena is known as glycemic memory. That the human body has a phenomena to remember the spike in glucose. And this basically accumulates, eventually leading to the metabolic disease diabetes. Okay, so we are working on this glycemic memory, and we have observed that this glycemic memory is basically responsible for many epigenetic alterations. Epigenetic alterations are the alterations which basically occurs without changing the DNA sequence. Okay, so they regulate the gene expression but without changing the DNA sequence. These are the alterations which basically opens the chromatin structure, or make the chromatin structure to a heterochromatin without causing the DNA sequence alteration. So I will talk about all these aspects in my today's lecture. Okay. So basically, we all know that the prevalence of diabetes is that diabetes, it is one of the oldest disease which is ever known to mankind, and its prevalence is increasing every day. Okay. At this moment, we are having more than 537 million people who are already affected with this disease, and these figures are expected to rise to 700 million by 2035. Okay, so this data is basically given by American Diabetes Association. So basically, it is predicted that the number of diabetic people will rise to 643 million by 2030 and 783 million by 2045. So every 3 in 4 adults with diabetes, they basically live in low income or middle income countries. And India is one of the is a middle income countries where we belong. So every the prevalence of diabetes is very high in India. Diabetes is responsible for 6.7 million deaths in 2021, and there is a huge expenditure on the treatment of the diabetic patients. And it is noted that in USD, if the expenditure is considered in terms of USD, it is 966 billion USD, which is basically spent on the diabetic patients in the year 2021. So there is almost 316% rise in this expenditure in the last 15 years. Uh, for 541 million adults, they have impaired glucose tolerance, which are not basically having diabetes, which are not basically detected with diabetes, but they still have an impaired glucose tolerance. They basically cannot digest the glucose, and they are at a high risk of developing diabetes in the coming time. The basic risk factors for diabetes are the sedentary lifestyle, type 2 diabetes, which is basically a lifestyle disorder. So sedentary lifestyle nowadays, people are sitting on their couch, they're just watching TV, less activity, less household activities, and increase in cigarette smoking, decreased physical activity, and adequate consumption of alcohol. These are all the risk factors for diabetes. Okay. In 1988, the diabetes mellitus was first observed as a metabolic syndrome. It was first designated as a metabolic syndrome. So it is basically characterized by insulin resistance. I guess you all understand what is insulin resistance. It means that the body is not able to detect the insulin levels in the body and cannot utilize the glucose. Our body cells, they cannot utilize the glucose as they become unresponsive to the insulin. Or there is relative insulin deficiency. Obviously, the rise in insulin concentration in the blood gives a feedback signal to the pancreas to decrease insulin release. Okay, and hyperglycemia. One of the major complication on which we work is, although diabetes is associated with many complications like retinopathy is there, neuropathy is there, okay. Then there are cardiac diseases which are associated with the increased prevalence of diabetes. But one of the major risk factors on which we are working is nephropathy, that is a kidney disease which is associated with diabetes. You must have also observed in your families that when a person uh, takes the drugs for the diabetes, like metformin, which is basically the prescribed drug for diabetes. So there is an increase in kidney damage. It was observed the person tends to have the kidney damage in the eventual coming times, and it may even require dialysis after the progressive disease. Okay. So we work on this diabetic nephropathy. We want to see what is the effect of glycemic memory on diabetic nephropathy. So approximately 20 to 40% of the diabetic patients will develop nephropathy, which may be the side effects of the diabetic drugs, which eventually converts to end-stage renal disease. Okay. The major risk factors again for diabetic nephropathy are high glucose, high insulin, proteinuria, which basically puts up the pressure on the kidney to filter the blood or to purify the blood and thus led to the kidney damage. So the major devil for the diabetic mellitus is hyperglycemia. So it is one of the hallmark feature for diabetes mellitus. Diet and environment has direct effect on growing realization that even transient episodes of hyperglycemia producing long-lasting effect that persists even following the strict glycemic control. So that is what we call as glycemic memory. Even a transient spike of glucose in the blood causes a long-lasting effect on our body, which is basically remembered as glycemic memory. There are certain evidences of increased micro and macrovascular complications of diabetes with increased duration of hyperglycemia. So hyperglycemia is responsible for many micro and microvascular complications. So this condition even prolongs after glucose control. Even if the person controls the glucose level, this transient, the memory for this transient spike in glucose retains in the body. That is known as glycemic metabolic memory or glycemic memory. Many pathways, many important mediators are there which are responsible for connecting the high glucose level in the blood to the diabetic nephropathy. Okay, so the basically high glucose level in the blood alters these metabolic pathways, alters these signaling pathways, metabolic as well as signaling pathways, which eventually led to a complex disease which is called as diabetic nephropathy. So glycemic memory, it is due to some irreversible mitochondrial and vascular changes. It has been evaluated before that glycemic memory, even a transient spike in glucose, causes some irreversible changes in the mitochondria or the vasculature of an individual, which basically accumulates to become a full disease termed as diabetes. However, the exact mechanism of this metabolic memory is not clear. People are still trying to evaluate more and more topics. They want to give it an epigenetic clue to explain the glycemic memory, but still the things are not very clear. Uh, Another important mediator for hyperglycemia causing glycemic memory is ROS. ROS is reactive oxygen species. Whenever our body, these reactive oxygen species are they naturally occur in our body during the normal metabolic process also. Some oxygen-free radicals are formed in our body, like peroxide ion or superoxide ion. But our body has a self-defense mechanism with which they can sequester these reactive oxygen species, and these reactive oxygen species thus cannot damage the other biomolecules which are present in our cell. But in the diseased condition, for example, in diabetes, or when the person is in stress, or whenever our diet is not adequate, so these all factors led to the increased generation of these reactive oxygen species. Okay, so there basically there is an increase in the number of the reactive oxygen species in our body under these conditions, and our body's defense mechanism is not adequate to sequester these reactive oxygen species. So these reactive oxygen species is basically responsible for causing many damages to the biomolecules, damages to the proteins, damages to the nucleic acids like DNA and RNA, which eventually responsible for causing the disease. Okay. Uh, Another important, except this reactive oxygen species, another important mediator is advanced glycation end product. So basically, the increase in the glucose level increases the glycation of certain proteins. Okay, so that there are certain AGEs, advanced glycation end products, which are developed, which are basically responsible for complicating the whole scenario. So basically, we basically works on this hypothesis that hyperglycemia is responsible for increasing the concentration of A's and also for the increased concentration of reactive oxygen species. These species are responsible for activating certain epigenetic changes in the cell, which basically retained as metabolic memory and eventually led to diabetic nephropathy. Now, what is epigenetics? I'm talking about epigenetics. What is epigenetics? I've already given you a clue. They are basically epigenetics are heritable changes. They can pass from the parent to the offspring, but they are the changes in the gene expression. Genetics is they are changes in the gene expression, but without changing the DNA structure, without changing the, you can say, the DNA sequence, the DNA sequence of base pairs. Okay, there are basically three types of epigenetic modifications. One is DNA methylation, histone modifications, and miRNAs. These all basically regulates the structure of chromatin, which makes the genes less or more accessible to the transcription machinery. Obviously, if the genes are more accessible to the transcription machinery, they will be expressed. If the genes are less accessible to the transcription machinery, like in heterochromatin, they are expressed less. Okay, so this way, these epigenetic changes, they basically are responsible for making the accessibility of the DNA to the transcription machinery. Okay, so we work on these epigenetic modifications to delineate their role in the in the pathogen in the progression of diabetes. It has been observed that the generation of age by glucose activated glucose, when there is more generation of advanced glycation end products, so they activated certain epigenetic changes which regulate the expression of genes like MCP1, NF-kappa B, VCAM1, vascular cell adhesion molecule, which basically are responsible for causing inflammation and tissue injury. It has been hypothesized that what happens when there is a transient spike in glucose, that spike in glucose is responsible for causing certain epigenetic modifications. These epigenetic modifications then eventually accumulates with time. For every transient spike in glucose, these epigenetic modifications accumulates in time, which are responsible for regulating the gene expression, eventually leading to the disease diabetes. So basically, there are three types of epigenetic mechanisms. One is DNA methylation, histone modifications, and RNA microRNAs. So I'll just give you a brief introduction of these three. DNA methylation is basically without changing the DNA sequences, certain methyl groups are added to the CPG regions, the cytosine and guanine rich regions in the DNA by enzymes which are called as DNA methyl transferases. These enzymes transfer the methyl group to these regions. So wherever these methyl groups are transferred, the chromatin structure shrinks and will become heterochromatin. It means it becomes inaccessible to the transcription machinery. So DNA methylation is basically responsible for decreasing the gene expression. Similarly, there are histone modifications. Histone modifications are of various types, like for example, acetylation, methylation, then there is adenylation, ubiquitinylation. Okay, these all modifications, we all know that histone proteins are the basic proteins. They're having the N-terminal chains which are rich in basic amino acids like lysine and arginine. So these amino acids are responsible for interaction of the histone proteins to the DNA and are responsible for the chromatin structure, the nucleosomal structure of the chromatin. Okay, what happens when these histone tails are modified in such a way that there is an addition of an acetyl group or a methyl group or a ubiquitinol group, they mask these positive charges on the histone tails. The histone tails are no more basic. They cannot bind to the DNA. They cannot wrap around, they cannot from the core to wrap around the DNA, and thus they get released from the DNA. So this opens up the chromatin structure, and the chromatin structure is more accessible to the transcription machinery. Okay, so that way they basically increases the gene expression. Then there are microRNAs. MicroRNAs basically are not directly involved in regulating DNA structure. They basically regulate mRNAs. Okay, so I guess you remember the central dogma from DNA. The information is passed on to mRNA, then it to protein synthesis. Okay, so mRNA, so microRNAs are basically complementary to the mRNA structure. When any gene is expressed, it is expressed in terms of forming more and more mRNAs. But microRNAs, since they are complementary to mRNAs, they bind to mRNAs and block their translation to the proteins. So, for example, for a corresponding protein, for the corresponding gene, the protein will not be formed. So, this way, microRNAs they regulate the gene expression. We basically work on one type of, of epigenetic modification, that is histone acetylation. So as I've already discussed, so histone acetylation basically is responsible for the addition of acetyl group to the histone N-terminal tails, which are responsible for their release from the DNA, from the chromatin structure, and opening up of the chromatin, which are responsible for more and more transcription of the gene. There more and more accessibility of those genes, or that local genes, to the transcription machinery. Okay, this histone acetylation is regulated by an interplay between two set of enzymes. Those are called as histone acetyl transferases. The name suggests they are responsible for transferring the acetyl group to the histone tail, and then other one is histone deacetylases. Histone deacetylases are responsible for the removal of acetyl group from the histone tail. So they are basically responsible for the shrinking of the chromatin structure. Okay, there are many types of histone acetyl transferases and histone deacetylases which are available in our body, but they all regulate the expression of gene. So there is a dynamic interplay between these two types of enzymes, acetyl transferases and deacetylases, which basically regulates the transcription of genes. Okay, one of the important histone deacetylase which we work on is SIRT1. It is basically it evolved from sirtuin to the yeast, which is basically a histone deacetylase which regulates the metabolic diseases, the gene expression in metabolic diseases. So the perusal of the literature, it highlights that strict glycemic control is required to slow down the progression of diabetic complications. So if a person is following the strict glycemic control, it can regulate the dynamic complication. But the transient spike in glucose that maintain a metabolic memory while altering epigenetic modifications like SIRT1 activity. So it has been reported before that the SIRT1 activity is regulated by the transient spike sorry, glucose. So even a transient spike in glucose can regulate the SIRT1 expression or the SIRT1 activity, which basically regulates the histone acetylation level and thus regulate the gene expression in the diabetic patients. So it can so these genes may belong to the inflammatory genes which are responsible, which basically complicates all the scenario. Can eventually lead to certain diabetic complications like nephropathy, neuropathy, or retinopathy. There are many certain activators which are in clinical trials but yet to be released into the market, like SRT-2379, SRT-2104, SRT-3025, which are basically proposed to be effective against metabolic disorders, but they are yet to be released into the market. But these synthetic SIRT1 inhibitors, when we are talking about the synthetic compounds are loaded with many harmful effects. They basically has many side effects which may further complicates the scenario, which may accelerate the diabetic associated complications. They may either maintain the normal glucose level but may accelerate the diabetic complications. Okay, so there are reports that there are certain side effects of these synthetic activators like neutropenia, electrolyte imbalance, arterial fibrillation, and QT prolongation. So the need of the art is to identify certain natural compounds which are basically the inhibitors of certain activity, which basically inhibitors or the activators. Basically, we are looking for the activators for the certain activity and can regulate the certain activity in the metabolic disorder. There are most of the studies which has been reported before, they basically lacks the mechanistical and structural insights of how the ligands interact with the certain protein and how they regulate the gene expression. Also, these natural products, they act as the lead compounds for the pharmaceutical industry so that they can be developed further as the novel drug candidates. So many medicinal chemists are also working on the natural compounds. They can modify the basic nucleus of the natural compounds to improve their activity against certain diseases. So an attempt is required to screen novel, safer, and more efficacious drugs by addressing both nutritional requirement and epigenetic modification. So what is our hypothesis? We say that the plant extract or phytochemicals, they possess the ability to reduce the oxidative stress, to reduce the generation of advanced glycation end products, and they can also regulate the epigenetic modification and can reverse the metabolic memory and thus diabetic associated complications like diabetic nephropathy. So we have published many papers in this regard. Our recent papers that highlight that many small natural molecules like phytochemicals, they can regulate the epigenetic modification. We have also discussed that these small molecules can regulate epigenetic modification and can reduce the complications of nephropathy in diabetic people. We have previously our previously published papers. We have used you can say we have designed our experiment in such a way. We have used a technique in which we basically go for the structural similarity searching, which we take the synthetic drugs or the other natural known molecules which are already known to have an effect on a particular molecule on a particular disease. So we take those known molecules and we want to mimic their activity. We want to find out the similar compounds which are structurally similar to these known modulators, known synthetic compounds or non-natural compounds. So we want to find out the novel compounds which basically are structurally similar to these known compounds, following the hypothesis that the similar compound, structurally similar compound, has similar activities because they interact with the biomolecules in a similar way. So they do have the similar activity. So we are proposing to use this same structure similarity searching approach, which we have already published in other paper, to screen small potent natural molecules which can modify the epigenetic axis and can remove the metabolic memory and prevent the occurrence of diabetic nephropathy. So for this study, which I'm going to discuss today, so this is our work plan. We first screen the natural epigenetic modifiers, which are already known by doing the literature search. And we also take the synthetic drugs like thiazolidines, like pioglitazone, metformins, budesonide, okay, which are already approved for the treatment of diabetes. And then we want to find out the using the structure similarity searching approach, we want to find out the structures which are similar, the molecules which are similar in structure with these known molecules. Once we fish out these structurally similar compounds, which are most probable be the drug candidates, we want to find out their interaction with the SIRT1 protein, whether they are basically the SIRT1 activity modulators or not. So we perform the molecular docking studies, okay, using autodoc Vena. We also compared their ADME profile. Then after we fish after these studies, in these in silico studies, we fished out certain potential drug candidates and then evaluate these candidates in vitro cell culture studies and in vivo animal models of diabetes. So these are some of the results which I want to discuss today. So we have using literature search, we have identified six basically known phytochemicals and synthetic compounds which are which are basically known to reverse the diamine with resveratrol, vanillic acid, esculatin, genistein, and berberine. Then we use the structure similarity searching approach. We find out the molecules which are structurally similar to these parent compounds. So we find out potential molecules, two which are similar to metformin structures, 12 with resveratrol, 5 with vanillic acid, 13 with esculatin, 13 with genistein, and 7 with berberine. So these structures we have selected, these molecules we have selected after putting uh, 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 after putting a barrier that more than 80% of them must be similar in structure with the known molecule. Okay. Then we dogged each of these molecules, all these molecules with SIRT1 catalytic domain, and we find out the potential binding energies. We compared the binding energies And we also compared their ADME profile. Then we find out the molecule which are the potential drug candidates which we can evaluate in vivo and in vitro studies. So with resveratrol, we found 12 different compounds which are more than 80% similar with the resveratrol structure, and they also shows the potential binding energies. Similarly, with berberine, we find out seven compounds structurally similar, more than 80%, or you can say more than 90% structurally similar with berberine, and potential binding energy with certain proteins. Metformin is a synthetic drug for diabetes. So we only find two natural compounds which are structurally similar with metformin and has binding energy. Although it is low as compared, the binding energy is high. Low as compared to the release binding energy is less as compared to other compounds. Then we take esculatin. Esculatin, we found different 11 compounds which are structurally similar to escalatin and compared similarity. Vanillic acid, again we found five compounds similar to vanillic acid, more than 80% similar to vanillic acid along with their binding energy. Genistein, again we found certain compounds which are similar and compared their binding energy. So these figures basically show the dock results of molecular docking. The most similar compound with the parent compound, and this is the SERT1 protein with its potential ligand. So they all shows the potential binding in the SERT1 active site. This is the molecular docking of the compound similar to metformin, the synthetic compound similar to metformin, although the binding energy is less as compared to the ligand. Again, for berberine, we dock the similar compound berberine with the SERT1 ligand binding site. Then the similar compound with estrogen. After performance, so similarly with vanillic acid and with genistein. So we also observed the interacting the amino acids which were common with the potential ligand, the standard ligand for the SERT1 ligand binding domain, and the other compounds and their similar compounds too. Then we also compared their ADME profile by using Swiss ADME tool, and we saw that all of these molecules, the molecules which we have selected for further studies, they all follow the Lipinski's rule of five, and they can be the potential drug candidates. These are the basically spider radar chart, and for comparing the ADME profile of this molecule based on all those studies, molecular docking studies, and take two compounds, ambaliferone and GABA, for our further studies, because we observed that these compounds were the potential drug candidates as compared to the other similar compounds. So, for further studies, we first want to check whether these compounds are toxic to the cells, to the human cells. So, we use a cell line, that is 3T3L1 cell line, which is human adipocytes, to find out the cell line cytotoxicity of these compounds. We observed that we took different doses of these compounds, ranging from 5 micromolars to 150 micromolars, and we observed as we increases the dose of per compound to 150 micromolar, even at this dose, 50% of viability, more than 50% viability of the cells were observed. Similarly, for GABA, when we increase the dose to 150 micromolars, almost more than 70% of the cells were viable. So we conclude with this that these two compounds were not cytotoxic to the cells, 3 adipocyte cells, and can be taken for the further study. The IC50 value of ambaliferone was found to be 199 micromolars and GABA 145 micromolars. Then we have also evaluated their antioxidant potential, because as I've already mentioned that oxidative stress is the major risk factor, is one of the major risk factors for diabetes. So we see whether these potential phytochemicals, they can reduce the oxidative stress or not. So we have performed the free radical DPPH scavenging activity for these compounds, and we observed that both these compounds, they can scavenge the free radicals, the free radical DPPH, and they observe they show a dose dependent activity. The IC50 for sequencing for inhibiting free radical DPP 107 micromolar, and for GABA it is 141 micromolar. So based on these studies, cell cytotoxicity studies and DPPH scavenging activities, we choose our concentrations for these two compounds for further studies. So we choose 50 micromolars and 100 micromolars. These are the concentrations at which we will observe less cytotoxicity and more scavenging effect for further studies. When we performed the cell culture experiments, we cultured our cells in artificial medium, that is DMEM medium, Delbecque's modified eagle medium, which contain all the nutrients and a pH indicator, which is responsible for the growth of the cells. We grow the cells under two types of condition. One is low glucose condition that contains 5 millimolar glucose, and another one is high glucose condition, which makes 30 millimolar glucose hyperglycemia, which we considered as hyperglycemia. So this hyperglycemic cells, the cells which are cultured under hyperglycemic condition, they basically mimics our diabetic condition. Okay. Then we also go for diet reversal to see the glycemic memory effect. So what we do, we culture the cells under hyperglycemic condition for like one subculturing for like 3-4 days. Then we shift on the media back to the low glucose condition, the normal glucose condition, 5 millimolar glucose, to see whether these cells may retain the effect of the, or they may retain the memory of the previous spike in glucose or not. We treat all these cells with our both the compounds ambaliferone and GABA at both the concentrations 50 micromolar and 100 micromolar. We observe the changes in the oxidative stress. So for this, we evaluate the lipid peroxidation level. As you can see here, as compared to the low glucose condition, has increased generation of lipid or increased lipid peroxidation levels, increased generation of lipid free radicals, you can see. Okay, diet reversal, even if we reverses the diet, so the lipid peroxide level is still increased. It is not reduced. Even after culturing the cells in a normal glucose condition, will not reduce the level of lipid peroxidation. But our both the compounds like ambaliferone and GABA are responsible for decreasing this lipid peroxidation level. Superoxide dismutase is basically an antioxidant enzyme. So we see what happens in diabetes. The level of antioxidant enzymes is decreased. So one thing, there is an increased oxidative stress. Another thing is that the level of antioxidant enzymes is decreased. Okay. So we also observe that there is a decreased level of it is SOD, superoxide dismutase, in the hyperglycemic condition, and the diet reversal still retains its memory. But our both the compounds, like they are in normal hyperglycemic condition, our compounds are not able to increases the SOD activity, but in diet reversal, our compounds are able to increase the SOD activity. Similar results are obtained for catalase and other antioxidant enzymes, and glutathione as transferase, which are another oxidative stress enzyme. So here we can conclude that under hyperglycemic condition, there is increased generation of oxidative stress. However, diet reversal will not be able to completely alleviate or completely remove this oxidative stress. But when we treat these cells, these diabetic cells, or you can say diet reversal cells with our compounds, in diabetic cells, they are the activity of antioxidant enzymes, but in diet reversal cells, they are able to increase the activity of antioxidant enzymes. So we can say that in diabetic people, this may be concluded that both diet reversal, bringing your glucose level to the normal, and certain phytochemicals which can remove the oxidative stress are both required to alleviate the effect of diabetes. Then we also checked the activity of SIRT1 and, expression of SIRT1 and histone H3 acetylation level, because we fished this compound which are responsible, which shows the potential binding with the SIRT1 protein. So we saw that the first lane is the control lane, second one is hyperglycemic lane, third one is diet reversal, and the fourth one is treatment with the respective compound. The above one is ambaliferone, the below one is GABA at 100 micromolar concentration. So we observed that when we treat these compounds, these with ambaliferone, there is no change in the SIRT1 expression. Even in the hyperglycemic condition, the SIRT1 expression is not changing. So these compounds are not able to reduces the SIRT1, or they are not able to inhibit the SIRT1 expression. But when we see at the histone acetylation level, we observe that under hyperglycemic condition, the histone acetylation level is reduced. It means that the genes, they becomes more, the chromatin becomes more and more heterochromatin, and the gene expression is reduced. Okay, but when we treat these cells with both the compounds ambaliferol and the GABA, they basically reverses the H3 acetylation level. So no effect was observed on the SIRT1 expression, but H3 acetylation level were increased by our phytochemicals. So these were the same results. So SIRT1 expression is not changed, but the histone acetylation level is increased after diet reversal and the treatment with the respective compounds. So then we basically jump over to animal studies. So where we basically want to further evaluate the effect of these two phytochemicals in vivo model of diabetes. We basically mimic the diabetic condition in the animals by feeding the animals on HFD, high fat diet. Okay, high fat diet contain the high concentration of fats and cholesterol, which are responsible for which mimics the lifestyle changes in the today's world, and is responsible for the occurrence of diabetes, hyperglycemia. We in addition to high fat diet, we provided these animals with the different concentrations of our compounds which we have selected from in silico and in vivo studies, ambaliferone and GABA. We also mimic the diet reversal in the animals. We first feed the animals with high fat diet for 16 weeks, 8 weeks, and 16 weeks, and then we reverse their diet to the normal diet, normal palate diet after 16 weeks. So this way we mimic the spike in glucose in the rats, and to see the effect of these phytochemicals on the glucose level. So we observe that there is no significant change in the body level of rats after treatment or after diet reversal, but the blood glucose level shows significant changes. We observe that in diabetic rat, the blood glucose level increases, whereas metformin decreases the blood glucose level. Diet reversal alone decreases the blood glucose level, but the treatment with our compounds, ambaliferone and GABA, is basically responsible for decreasing the blood glucose level. Similarly, with cholesterol, we observed high level of cholesterol in the blood of diabetic animals, but our compounds are able to decrease this cholesterol level. Diet reversal again has no significant effect, although has significant effect as compared to the negative control, but still they have high cholesterol level. But our compound, the treatment with our compound significantly decreases the cholesterol level in the blood of these animals. Similar results are obtained for the triglyceride levels. HDL, high density lipoprotein, is basically decreased under the diabetic rats, whereas LDL concentrations are increased under the diabetic rats, wherever our compounds are able to reverse these changes. Diet reversals still retain certain memory of the increase or decreased levels of HDL and LDL respectively, and our compounds are able to remove these effects. Then we also perform the renal function test to see the effect on the diabetic nephropathy. We observe that there is increased blood urea nitrogen, creatinine levels in the diabetic rats, but our compounds are able to reduce this level. Diet reversal again retains certain
Pardon to disturb you, but your voice is not audible.
Hello? Hello? Am I audible?
Yes, ma'am, you audible.
I'm audible?
Yes, ma'am.
I was audible before?
Okay, okay.
Yes, yes, madam. Please continue. No problem.
Okay, thank you, sir. Okay. So in vivo results also shows that there is liver malfunction in the animals with diabetes and diet reversal too. You can see here. So with the diet reversal too, but our compounds were able to reduce these levels significantly. SGPT levels and alkaline phosphatase levels also shows liver malfunction because diabetic animals, type 2 diabetic animals tends to develop the fatty liver disease with the progressive disease. So this our results were in coherence with those studies. Okay. So then we check the histopathology of the kidney tissue. We see that under the diabetic condition, there is the shrinkage of the glomerular structure. There is increase in the lumen size, but our and even in the diet reversal negative control, diet reversal conditions, still the glomerular structure is shrinked. But the treatment with our compounds were able to produce the protective effects. Even metformin, which is our positive control, produces the protective effect in diabetic nephropathy. Then we perform the antioxidant enzymes in these animals, and we see again that the lipid peroxidation levels were increased in in the kidney disease, in the kidney tissue, whereas the activities of enzymes like catalase, SOD, and GST were reduced in the kidney tissue in the diabetic animals, and even diet reversal animals. These conditions were still prevalent, but the treatment with our compounds were more pronounced in the diet reversal model to reduce the to reduce the level of antioxidant enzymes, to improve the level of antioxidant enzymes in the kidneys of the diet reversal animals. It is observed that the effect is more pronounced in the diet reversal. The effect of our compound on oxidative stress is more pronounced in the diet reversal group as compared to the diabetic group with no diet reversal, which were continuously feeding on the high fat diet. Okay, so the effect were more pronounced on the diet reversal group. So with that, we concluded that both diet reversal as well as the treatment with the antioxidant phytochemicals like ambaliferone and GABA both are required for reversing the effects of hyperglycemia. So then we also observed the changes in the SIRT1 levels in the diabetic animal group, but we didn't observe any significant change in the SIRT1 expression level, and our compounds were not able to change the SIRT1 expression level in the diabetic compound. But we have observed in the in vitro studies that the SIRT1 activity is changed because it regulates the histone acetylation level. So no significant increase in the SIRT1 activity was observed. However, it is further decreased. You can say SIRT1 expression is observed in the diabetic rat. So this basically shows that the further studies are required to delineate the role of SIRT1 in glycemic memory. But definitely our compounds along with the diet reversal can reverses the diabetic nephropathy conditions in the diabetic animals, in the type 2 diabetic animals. So here we concluded that ambaliferone and GABA, they potentially bind to the SIRT1 active site by in silico studies. They were able to reduce the oxidative stress in the cell lines. They were able to have antioxidant activity as shown by DPPH free radical scavenging assay. They were not cytotoxic to the 3T3 adipocyte cells. They were able to reduce the diabetic nephropathy complications along with diet reversal in the animal models of diabetes. So, in the nutshell, we can say this data can be used to create a new diabetic nephropathy and metabolic memory treatment plan, because this is the first time we are producing these type of models for glycemic memory. Our data also suggests the clinical applicability of GABA and empagliflozin. They can be the potential drug candidates for the nephroprotection in diabetic patients. However, further research is needed to establish the mechanism underlying certain inhibition and fibroblast activation and proliferation. So that's all for today. So these are some of our publications along with my students related to this thing. Thank you. If you are having any questions, the questions are welcome.
So thank you for this wonderful talk, man. The house is open for questions. Any questions from the house?
Hello.
Yeah, I think no one is asking. So just as a basic discussion, I would just like to ask you that in terms of in silico techniques, how much reliable are these techniques as compared to in vitro or in vivo? As
Sir,
we
if you say in silicose techniques, obviously they just give you a picture. They just give you like initial clue that this may be happening, but you need to still validate them in vitro and in vivo studies. So that is what we are doing. We are basically fishing out certain molecules by in silico techniques, and then we validate those results in vitro and in vivo studies.
okay. So, so with this, I would like to thank you, ma'am, for this wonderful talk. So, on behalf of IQAC, ISFCP cell, actually this lecture was conducted on behalf of IQAC. So, I extend a really vote of thanks to today's expert speaker, Dr. Jeena Gupta, ma'am, who spared time from his busy schedule to grace this event. Ma'am. And today we had an opportunity to hear your views on the topic glycemic memory and epigenetic modifications in diabetes. And this will surely be going to encourage us in our future research events.
Yes, sir. Thank you, sir. Thank you for the invitation.
Okay.